All right, we should have more people joining soon. People are leaving class now. I'll just do brief introductions. For those of you who don't know me, my name is Marcia Castro. I'm the Endel Professor of Demography in the Department of Global Health and Population that I also chair. Thank you all for joining us for another event of our Global Health Week. And this year, the theme of our Global Health Week is the 30 years since the 1994 International Conference on Population Development that happened in Cairo. That conference placed sexual and reproductive health and rights at the center of sustainable development. We have an exciting week of events. Tomorrow, we have the screening of the documentary called The Janes. We have a brown bag seminar on global family planning programs on Thursday, and our capstone symposium and poster day on Friday, which will feature the keynote address from Dr. Natalia Cannon, the Executive Director of the United Nations Population Fund. We hope to see you at those events. So today, we're very lucky and excited to have Dr. Carmen Barroso and Dr. Kelly Blanchard. They will discuss the role of feminists in shaping the 1994 conference in Cairo, and whether the framework of the program of action is still relevant and helpful today. Brief introductions. Dr. Carmen Barroso is a lifetime advocate for sexual and reproductive health and rights. She was previously the director of the Cairo Foundation Population and Reproductive Health Program, as well as the director of the Western Hemisphere region of the International Planned Parenthood Federation. Dr. Barroso has received the 2016 UN Population Award, the 2019 Women Deliver Award, and the Fred Tsai Award for lifetime commitment to sexual and reproductive health and rights. Dr. Kelly Blanchard is the president of Ibis Reproductive Health. She opened the Ibis office in Johannesburg, South Africa in 2003 and oversaw their work in the region until 2004, when she returned to the US and was appointed president. Her research includes clinical and social science studies on improving contraception and abortion technologies, expanding access to and quality of reproductive health services, and documenting the impact of policies on women's health around the world. As a reminder, please keep your your microphones closed until we go to the Q&A. And I want to remind everyone that the speakers have been invited to share their own perspectives based on their scholarship and experience. They do not represent Harvard. Thank you both for being here, and I'll turn over to you, Kelly.
Thank you so much, Marcia, and it's a real pleasure to be here with all of you today. Thank you for joining us for this conversation. And it's a real pleasure for me to get to talk with Carmen today. In addition to what are just many honors and contributions to the field, Carmen was a board member at Ibis Reproductive Health, and it's just great to be able to be back in conversation. And she's had so many important contributions to Ibis that I'm so grateful for. So great to be with you, Carmen, today. We're going to jump right in and talk about the Cairo conference in 1994 and what it means 30 years later. So, Carmen, why don't we start? Why do you think it is important to commemorate this anniversary? And can you explain the title, which was suggested by you of today's conversation, Shifting Global Health Paradigms and Effective Advocacy, Feminists Making the Impossible Possible in Cairo?
Thank you, Kelly. It's so good to see you again. I always thought the world of you, and it was an honor to be in the board of Ibis, this small research organization that has done so much. It has made such a big difference in the field. Thank you. Your question. Well, the title is because, as Marcia has said, the conference was really a landmark. It shifted the paradigm. And the prevailing paradigm at the time was still the paradigm of population control, the effort of curbing the rapid growth of the world population. And the new paradigm that emerged after Cairo was the paradigm of reproductive health, reproductive rights, sexual health and sexual rights, some less developed in Cairo, as we are going to discuss further, like the sexual rights and that only came to be fully articulated in Beijing and later. But the seeds were there, so it was momentous. It was really a change with enormous consequences, because the population control paradigm was both an ideology and an orientation of the programs. And if the programs wanted to curb the number of children of women, many times there were egregious neglects of the rights of the patients, of the individual women. There were, for instance, examples of Puerto Rico women being submitted to testing of the emerging birth control pill with very high dosage and without their knowledge of what they were participating on. There were common abuses of sterilization without fully understanding of the women, of the consequences, and so on. So this was what prevailed at the time. There was also lots of good family planning programs going on, respecting the rights of women, but the prevailing, the dominant paradigm was not conducive to that, right? So the new paradigm focus on individual rights put women at the center of the policies, not only as individuals choosing what they want, when and how, if and when to have children, but also as participants in the policies. Women emerged as political actors that deserve to be listened to, bring their perspective of what the policies should aim. That was a major shift for Cairo. And I could go on, and maybe we could stop there, because there were also political implications. The population control paradigm was seen as a replacement for economic policies that were more fair and just. For instance, Lyndon Johnson said that $1 spent in family planning is worth $100 spent in development, and so there was a natalism, antinatalism ideology there that said, no, let's just have fewer children and then forget about combating poverty. That's not important, combating poverty. So that was on the one hand. And then they left the victims of this colonialist will developed another natalist policy, the opposite. The antinatalist of the population control provoked the creation of the natalist policy. No, let's have lots of children to conquer the world. And then in Latin America, leftists said that the birth control pill was killing gorillas in the womb, some crazy things. So from one hand, natalist, and the other hand, antinatalist, none of them paying attention to the perspective of women. That's what prevailed before.
And maybe in a minute, we'll come back to sort of the who's and the what's of shifting that paradigm too, when we talk about your role, Carmen. But two things
I think it's my turn to ask you a question.
Please, now go ahead.
And you, Kelly, why do you think that the conference is worth commemorating?
Well, I think the ways that we have over time come back on the important anniversaries of the conference, I think each of those commemorations is a really important moment to lift up, as you said, Carmen, the critical piece of the framework in the program of action that really centers people and families and communities and their rights and their ability to, and the need for policies and products and services to support their right to have the children that they want when they want, to build the families that they want when they want. And these markers, these anniversaries, I think are important for us to sort of continue to reflect on that. And where have we seen success? Where have we seen improvements or achievements? And where do we continue to see important gaps that really need to be addressed? And I think that this sort of goes to the broader picture, which I know, Carmen, I've heard you talk about, but sort of when and how we think about the history of our movements and where and what pieces of, whether it's advocacy or research or community leadership or the ways that we do our work, where we have seen important progress and where we have seen things fail, and how do we ensure that we learn from those lessons. And so I think that the two pieces of the sort of taking stock meaning of these anniversaries, as well as continuing to want to see at the global level this real commitment to the sexual and reproductive rights frame that was so important starting in Cairo.
Kelly, if I may add another thing, I think it's particularly relevant to commemorate it now because authoritarian forces are emerging its ugly head all over the world. And as you said, looking at the what was achieved and what was not achieved, we can prepare better to resist this authoritarianism. And that's particularly important because authoritarianism is a plague that threatens democratic institutions and so on. But it's used reproductive health issues in a way as a weapon against the democratic values, you know? So you hear, for instance, the caricature of gender ideology and the blaming of all the ills of contemporary society to the progress that has been made in more egalitarian families, in the liberation of women, and gender rights, and so on. So that is very crucial in a broader political landscape. And I think it's important also to see that in this very bad global political landscape, that we have been in the past in a very bad political landscape too. Cairo occurred against the fierce opposition. The Pope went ahead to write to all heads of state, urging them to boycott the conference. Imagine that. It's going back to the title that you asked me about, saying making the impossible possible. It seemed that it was impossible to do what the feminists did. They were able to build alliance among themselves. There's a variety of feminism, and each one of us think differently, but we all got together and built a common strategy. There were alliances with prominent demographers and other academics with whom we seldom had direct dialogues before. And there were alliances even with the governments. I think Friday, Jacqueline Pitangui is going to mention the important role that the feminists had in making the Brazilian government delegation to be a defender of reproductive rights. So, and this kind of alliances are very important today.
It's such a great addition, and I think particularly this year of so many elections across the world, and the moment of all these elections happening at this time, coinciding with the 30th anniversary, I think this point about how sexual and reproductive health and rights, the quote unquote gender ideology, so many of the pieces of the progressive rights-based approaches in the world are under threat. And as you said, are weaponized by governments in an attempt to maintain usually right-leaning conservative anti-democratic forces, autocratic forces maintaining their power. And just a quick note to say, in the United States, since the Supreme Court Dobbs decision, which eliminated the constitutional protection for the right to access to abortion care in the United States, that reverberation we see across the globe in many different places. We've seen different countries cite that decision as sort of a reason, and that rightward shift in the court in the US, and seeing that cited across the globe in this moment as additional fodder for continued restriction of sexual and reproductive rights in many, many different contexts. So we're seeing that same, exactly as you said, that same weaponization of sexual and reproductive health and rights in many contexts as we go into a really big election year this year. But going back to 1994 and to the conference, Carmen, you played many important roles as a funder, as a participant, as a thought leader in that moment. Do you want to say a bit more about your involvement and the different ways that it helped lead to these paradigm shifts that you've been describing?
Well, I was privileged to contribute a little bit to this broad range of actors that made change possible. And I started my involvement with reproductive rights 20 years before Cairo. I soon after I finished my PhD at Columbia, I went back to Brazil and created a Women's Studies Center, a first one in the country. And there I did research using participatory methodology with women from the periphery and on sexuality and reproduction. And I learned a lot with them, because I was concerned, I was a middle class women concerned with the huge inequalities in the country. And I really saw very clearly that the poor women had a double burden of poverty and of gender inequality. So my interest was there, and they taught me a lot. They taught me the need to go beyond the critique of population control, because I started with a critique of population control. But they said, well, but we do need family planning, it's something that we want. And you cannot just criticize the ideology and the lack of respect of human rights and so on. You have to make proposals. And that was something that I learned from them. And not only me, but the feminist movement in Brazil became more proactive in proposing we call integral policy on women, or integral health policy on women, the rough translation. And that was, women are not just wombs, they are not just baby machines, as both the natalists and the antinatalists consider that women as baby machines that should be turned on or turned off. But they were human beings with needs and rights, and they had many complex needs that needed to be attended to by the health system. And the first taste of victory of the feminists was in 1983, when the Ministry of Health of Brazil launched a new program that had this approach of women as whole beings. That was a partial victory, because the implementation of the program left a lot to be desired, but it was a first taste of the capacity to influence government policies. So then came the preparation for the conference. In 1992, the UN was holding big global conferences on major policy issues like climate, human rights, and then population, and then later women's conference. In these conferences, the governments of the world got together in the Intergovernmental Conference, and there was a parallel civil society forum called the NGO Forum. Well, in Rio in 1992, at the NGO Forum, feminists were very tough on the criticism of population control. Now, UNFPA was planning the Cairo conference for 2 years later, and they wanted the conference to happen smoothly without disruptions, and they were afraid that the feminists, if they were there, they would cast a shadow over the conference. So they were thinking that perhaps better not to have a civil society conference at the same time. And so what we did, and I think was quite important, was later recognized by UNFPA as important. I was directing the population program at the MacArthur Foundation in the early 90s. I started in 1990. And there was Jose Barcelato directing the program at Cairo, and there was Steve Sinding directing the Rockefeller Foundation. These were the three major foundations and several other smaller foundations at the time. We got together in Chicago and asked Nafis Sadig from UNFPA to come because we wanted to show that the feminists were now building proposals, alternative proposals, that could bring new blood to the population field. They were not just criticizing, but they would be helpful. And that allowed UNFPA, Nafis Sadik was the director of UNFPA at that time. She went to Chicago for our meeting. She agreed with us and she became a champion of reproductive rights. So I think that was the major contribution. Later on, we managed to get the board of the MacArthur Foundation to approve a special budget for funding feminist, well, not only feminist organizations. We were proud to fund the Harvard Center for Population at the time, who was leading new thinking. And so we fund lots of organizations that contribute to what happened in Cairo.
I think that the role of philanthropy there in supporting civil society engagement is one of the really interesting lessons about how we can, think about supporting ways for our sort of global architecture to be more responsive to people, to feminist movements, to grassroots movements. So that's a really interesting, lesson that's, broader than Cairo, but important. And as you said, was one that's really influenced how UN conferences really happen now, which is with a much more formalized engagement of civil society.
Now it's my turn to ask.
Go ahead. Go ahead, Carmen.
Please tell us, when you first learned about the ICPD, as it was called, the Cairo Conference, and how it came to, over time, to influence your work.
Yeah, I started my master's program at what was then the Harvard School of Public Health in population, that word again, and international health, which is what the department was then called, in 1995. So as I began, my more in-depth training and learning about, demography and global health and development broadly, the paradigm shift, there were folks, as you said, who were on faculty at the school who were involved in the program of action and in the conference. And those discussions were happening in the department. I think it was still seen as quite a radical and not implemented shift at that point, but one that I think was extremely important to me in my own thinking about my career, because that shift in the framing of the program of action and the way it's centered people's sexual and reproductive rights has been influential in all of the ways since then that I have done research, that I have thought about research, that I've thought about my own career. And part of what has been really appealing to me about public health and the part of public health, sexual and reproductive health rights and justice, where I have spent the last 25-ish years of my career. So it was important. I also was involved in during the 15th anniversary in a book that was in part based or supported by a group that was housed out of the Harvard Pop Center at that time, the Group on Reproductive Health and Rights, that continues to exist today here in the Boston area. And in that book, I wrote a chapter focusing on how the program of action really created a framework that was important for the development and improvement and testing of reproductive health technologies, and how, going back, Carmen, to your point about participatory research and the ways that we think about individuals and their involvement and their rights and the importance of centering them in family planning programs or the development of family planning and other sexual and reproductive health technologies, wrote about how the framework of the program of action really can be seen as a roadmap for development of technologies that respond to individuals' needs, and that the implementation of those technologies and the policies that surround them are so important. As you mentioned, the sterilization abuse, the lack of access to the full range of methods, which is also a rights violation. Both sides of that coin of family planning technologies and policies, that they're not about the technology, they're about the framework and the ways that people's rights are supported or not in service delivery. And that was sort of what my chapter focused on. So that's an interesting place. I came back to the program of action 15 years later, thinking specifically about the work I had been doing on abortion and contraceptive technologies. So that gives a little bit about, over time, sort of how Cairo influenced my own career. But Carmen, maybe you can say a little bit about what you think over the last 30 years have been the important contributions. I think you started to touch on some around the way it sort of set out a framework for civil society engagement, but what are other ways that you see the program of action having had an important influence over the last 30 years?
Well, as you mentioned in several ways, I think the influence went much beyond our hopes. It was enormous. The core principles are still very relevant. Women as agents, not passive patients, and that women as right holders. I think that this is today much more widely accepted in the general culture, in the zeitgeist, that I remember, for instance, that middle-class women in Brazil in the 80s still believed that doctors had the authority to decide about sterilizing them or not. They didn't question that. And it was, they internalized this patient ethos, and not only middle-class women, I remember also a union leader told me that she learned that she had been sterilized later on when she went for a postpartum visit, and the doctor said, "Oh, by the way, I sterilized you." And I said, "Oh, you sued the doctor?" She said, "No, he knew what was better for me." This is a union leader. Okay, so that was the influence of Cairo now, that I don't think I would find that let's say renunciation to your rights that existed and in the past, and people didn't think of themselves as a rights holder, and this is part of the culture now. at least to a much wider part of the population. But I also look at the statistics, and WHO published recently of some data about the substantial progress. The number of women using modern methods of contraception doubled since Cairo. And the HPV vaccine is now part of the routine vaccine schedule of 60 countries, not an insignificant thing. And there were other successes in the area of abortion, an area that Cairo itself was not able to put on the books, but now 60 countries have liberalized the laws of abortion. And maternal mortality has declined, not as much as it should, and with huge inequalities between countries, huge inequalities within countries, but the overall ratio has declined. So there are lots of things to be celebrated from the Cairo influence of all these years. And I think that I have a question for you now. If I may, before I ask you a question, I would add that there are new needs too. The influence of Cairo was very good, but the situation now is different, And one thing is, I think one aspect that I think needs to be further developed is this changed demographic reality. We are now in a world where, with the exception of Africa, most countries are in a much lower fertility rate. Now, the authoritarians are exploiting that as they needed to turn on the baby machine and baby producing machines again and increase the population. I think that's unacceptable and needs to be firmly opposed by the feminists. But I think that also new feminist thinking, together with the brilliant demographers that are now at work, should take a careful consideration of policies that could look on whether some of this reflects undesired childlessness, and or women who would prefer to have children or to have more children than they have and don't have the economic and the social support they need to do that. And what are the policies? When we talk about intersectionality in terms of the feminism and so on, we have to address this issue of economy, of the economic inequalities, and how to develop the care economy, to how to support women who are the only caretakers in most families. Still, there's a shift now. There is many families where men are sharing the caretaking job, but not all, of course, and still the majority. I think women have to take care of the children, to take care of the old people, to take care of the disabled, to take care of the sick, and this is neglected in our thinking. How do we promote reproductive rights, both to avoid childbearing if you want, or to have children if you want? And that needs more than just access to pills and so on. It needs social and economic support of the society. So now I have a question for you. You please tell us more about the Ibis work, and where do you see Ibis taking us beyond Cairo or picking up issues that didn't get enough attention at ICPD 94? Ibis has been a pioneer in the work of abortion. Please tell us more.
Yeah, I mean, that is one of the key places where Ibis's work has really been focused on that gap where Cairo, as you said, did not incorporate a specific statement about or attention to abortion, using the word abortion. I mean, you can give us more flavor, Carmen, about the discussions around that. I'm sure, you know, the interpretation of sexual and reproductive health and rights for many included, of course, the right to decide not to continue a pregnancy if one did not want to. But again, the negotiations that went into the program of action did not specifically mention abortion. And we have faced decades in the 30 years since of similar conversations about what are, how abortion rights are or are not included, who is willing to include them explicitly and who is not. And Ibis has, from its entire existence, we celebrated our 20th anniversary in 2022, have had as one of our top priorities, and in fact, the top priority, improving access to high quality, affordable abortion care for everyone, including all types of abortion care that have been proven safe and effective. And really wanting to, again, which does align with the framework from the program of action, ensure that people can access the care in the way that they want, can access the abortion method that they choose and prefer, and that they're supported to do that by the policies and the healthcare systems that surround them. So Ibis has been involved for many years in specific work around improving clinical care, improving access to medication abortion, to highlighting different regimens of medication abortion and how important they are for access. We're very proud to have been involved in a recent study in very close collaboration with feminist accompaniment groups and abortion hotlines to demonstrate that abortion with medication abortion is safe and effective even without access to a formal healthcare provider, and that people seeking abortion themselves are very well able to manage the medication abortion process, and that we saw this reflected in some of the recent WHO updates of the safe abortion guidance that identified women themselves as appropriate, safe, and effective providers of abortion care. I think we also have explicitly articulated at Ibis, I mean, Carmen, you've mentioned explicitly the harms for sterilization. You mentioned the research from the initial development of the birth control pill in Puerto Rico. Research itself has been a tool of oppression and harm, particularly in sexual and reproductive health. From the very earliest days of the development of gynecology and surgery on enslaved people with no permission, to these recent abuses. I mean, it's very recent. We've seen sterilization and other abuses in prisons in the United States. We continue to see forced sterilization in Southern Africa of people with HIV infection, for example. Sadly, these kind of abuses continue, but we at Ibis have worked to articulate the frameworks for research that we center in order to both grapple with and reckon with this harmful history of research, and to articulate how we will do research in ways that shift power and uphold people's rights. So we have on our website the articulation of our how we do research with a human rights and reproductive justice lens. And I think the reproductive justice framework in particular, which also was developed and formalized by 12 Black women in 1994, so out of the same moment as Cairo, but really went beyond the Cairo program of action. And we at Ibis try and do all of our work with a reproductive justice lens. And where I think that lens has really gone beyond is the way that it incorporates some of the intersectionality that you've been talking about. It talks not only about your right to have a child, or not have a child, but it talks about the right to parent children in environments that are safe and supportive of parenting. And I think really going back to this point you were making about the care economy and the ways in which we need to really think about the environments in which people have their sexual and reproductive rights. And those rights are not realizable without addressing economic and social rights and some of the other topics, of course, that were not as prevalent at Cairo, which we talk about, which are much bigger issues in our consciousness today: environmental justice and the problem of the climate crisis, the rights and need to really center LGBTQIA plus folks in our sexual and reproductive health and rights conversations. And so I think we have seen at Ibis the importance of the reproductive justice frame and the ways that gives people the sort of positive support for their rights, not just a protection from the harms that have been done in the name of population or family planning, but also gives them their positive rights to have children, build families. And that, again, at Ibis, it's very important that includes explicit mention of and access to abortion care. But I think very much it's important to continue to remember, as you said, that parenting is a critical part of many people's experience and family formation and community well-being. And that those pieces of the reproductive justice framework, I think, really showed us, and I think we're seeing globally the reproductive justice framework getting more attention and traction. It takes us a bit beyond the SRHR framework of the program of action.
Thank you.
So back over to you, Carmen. And again, we're seeing a thread through this conversation, but you mentioned things that are similar then and now, and the importance of the opposition that we face, and some of the challenges that those of us looking to advance sexual and reproductive health rights and justice face. What are the lessons that you would draw from your experience with Cairo, with the program of action, with what's happened since, what you've seen happen over the last 30 years? What lessons should we be drawing for this moment?
Well, let me select just two of them. There are many, but one is in the line of what you just said about reproductive justice and intersectionality. I think I already mentioned how important the alliances built by feminists in Cairo were, because they gave the strength, the political strength, power, the political clout to make the actual difference, right? Without alliances, feminists would go home crying, that was... What we need now, I think, is more attention to alliances among ourselves. We are very diverse, as I said before. We came in all shapes and colors and ideologies. Feminism is so dynamic, and we need alliances, strong alliances among all kinds of feminists, so, across classes, across ages, across sexual orientations, across gender identities, across political parties. I think let's celebrate the richness of our diversity, and let's propose transformations that will take into account our diverse lives, because some are important for me, others for you, others for other people. No, so there is a whole panoply of changes that need to be made. So, and our demands cannot be ignored. We put them all together and fight for them, supporting each other. But the other thing that I think, a lesson that we learned in Cairo, and we may have to make adaptations today, is the role of global conferences. I think they still have a role. And there are other global gatherings that I think are important, like the CPD that is happening next month in New York, the Commission on the Status of Women that just happened. These are important moments to learn, to build alliances and networks and so on. I still think they are important. But the power shift, the political power, has changed since the time of Cairo. And a lobbying in the corridors of power are important, but are not enough, because the authoritarians have learned a lot from the civil society movements of the past, and they are now very smart in mobilizing the hearts and minds, and ironically, of those who are the worst victims of the current system. They are the supportive authoritarianism because they have less access both to economic resources, but also to cultural resources. And then it is easy to capture the mind of people who didn't have opportunity to develop their critical skills, right?
Mm.
And so there are this proliferation of this ideology that strengthen the authoritarians and make them win elections in important countries that we remain unnamed. But we have to do a new battle that I honestly I don't know how to do it because I am not such a so involved in this at this moment. I just know that politics are important and we cannot decouple our fight from the what happens in elections. We have to be present there, but I think we need to combat a fabricated fear about the destruction of the family. For people who are destitute and for whom the family, real or idealized, is the dream of something good in their lives. And if they believe that feminists and gays and trans are coming to destroy the family, they will forget about the exploitation, economic exploitation they are submitted to. They forget about other more important sources of their predicament, and they just trust those demagogues that promise the return to an idealized world that never existed, and
That
if
never
existed,
existed.
and if existed, it was for the benefit of few, and the problems for most. So I think there is for the feminist movement is how do you translate hard data in a way that people trust your data? Because I know, for instance, I had a dialogue with a Brazilian who said, I quoted some data from the IBGE, the census agency, and this person said, but you trust IBGE? Well, do you know who is the head of IBGE? He's a friend of Lula. So as if the fact that there is a so-called friend of the president who is demonized by the authoritarians,
Yeah.
invalidate all the demographic data that could change their minds. That's the kind of new struggle that we have to find ways to solve. And I'm sorry that I don't have a solution for that.
Well, I do think, I will say, in terms of, thinking about the role of feminists and these alliances that you're talking about and what we do now. And I have one question, so I'm just going to say this briefly and then ask Marcia to ask her question. But we have seen at Ibis, that research I was just talking about medication abortion and use of medication abortion outside of clinical settings. That innovation was feminist groups responding to the needs for access on the ground, and our partnership with them and the ability to come into alliance with feminist groups to document what was needed to convince like the WHOs of the world. And it's similar to the work we've done recently in the US around moving the birth control pill over the counter, where young people and advocates for access to young people were so critical from day one in our, what has been a battle for particularly people under 18 to get access to the sexual and reproductive health care they need in the United States. And having those young people at the table to begin with really was critical to making sure that people heard from individuals and were able to step away from this idea of that the fear of what these things would mean, and had actual young people talking about their needs and why this was important. So I really do see the possibility for this lesson about alliance with feminists, with advocates, with community members themselves as critical for this moment. But let's have Marcia jump in and tell us your question.
Okay, so this discussion is fascinating, and you said several things, Carmen, that kind of connect to what I wanted to ask. So the first thing is, it's fascinating how governments are never happy with population growth. It's either too much, it's either too little, and they come back and forth, and they're never happy. And we can see several countries now where fertility is so low that they give all kinds of incentives and it doesn't go up. I mean, we have several examples in Europe. So that's one point. The other point is this whole thing that is happening now in many countries, which connects to, I think, Naomi Oreskes' book. It's the Merchants of Doubt. They put doubt on facts, and then we have what we have, and I don't have to tell you what it is. But I think one of the things that I think it's important for us to discuss a little bit, and again, I don't know how to address this, and I don't think anybody does, but one of the main things about Cairo was this idea of empowerment of women, which was absolutely novel. It involves education, it involves participation in the labor force, it involves leadership. And yes, of course, we made huge progress, but there are some of items that we're still lagging behind. Leadership is one of those, representation is one of those. And I think we have some population groups that are very much outside this discussion. And let's take a country like Brazil, very low fertility, below replacement, and yet we have a very high adolescent fertility. And this is connected to sexual violence. This is connected to the lack of empowerment. And it's kind of brutal because some of those women are in the school and then they get pregnant, and maybe because of violence, and then they leave school and there goes empowerment. So I think on the one hand, we have this huge burden on care, that women take care of themselves, their kids, their parents, and all of this. Then some of them want to have more kids and can't. Some of them are having kids that they don't want, and some of them are suffering this violence, and it's a different level of unwanted. At the end of the day, this all comes back to empowerment of women. So how do we connect those things? And I'm not quite sure how much adolescent fertility, for example, and sexual violence was in the discussion 30 years ago. So I would love your reflections on those issues. And again, you were there, and you were also in the pre-conference meetings that led to the program of action. So I would love to hear your reflections on this.
I am glad you raised that. It's so dear to my heart. It's an area that I think feminists have have neglected, because the feminists concerned with reproductive health and rights have been addressed mostly health policies. They forgot about education policies. And education is I think, neglected overall. The budgets for education are ridiculous. The quality of education in Brazil is appalling. And comprehensive sexuality education there, Brazil was a pioneer in little small groups that developed a lot of materials and thinking about comprehensive sexuality education. But as far as I know, I may be wrong, but I think it didn't go beyond pilot level. It did. The schools have offered very little help in forming critical thinking for the masses, for the public school. I think critical thinking is essential for empowerment. And the adolescents that need to make decisions about their sexuality and about their use of contraceptives, if they want to postpone childbearing. Most of them do, you know that better than I do. But I think the key is education, and feminists is a very neglected area. The study of the lack of contribution of schools, which are now much more widespread. In the past, public schools were rare, and most kids dropped out of school after elementary school, or even didn't go to elementary school. Now, I'm not extremely up to date on the statistics there, but secondary school became much more widespread worldwide. But what the quality of that school is, and it should be a strong advocacy item for everybody concerned with reproductive health and rights, because you're right, Marcia. The adolescents, not only in Brazil, but I think in other countries in Latin America too, they are lagging behind the empowerment of older women, and with lifelong consequences, because a disempowered adolescent that becomes a mother will have a lifelong disadvantage in opportunities for being empowered. There are exceptions, of course, but they are very rare. An adolescent mother is really handicapped for life. And
Well,
I think both your points about the importance of empowerment and about the neglect of adolescents are crucial.
and I know we've just hit our time, so we're going to wrap up. I did just want to reflect, Carmen, that in our work in South Africa, where Ibis convenes a coalition of young people, it's a coalition led by and convenes young people on sexual and reproductive health, and we've worked both with the Department of Basic Education and with the Department of Health there. These issues are very similar to what you describe in Brazil, and again, the importance of the alliances across those silos, the importance of investment in all of those areas, because one key problem is you need to invest in the teachers and the infrastructure in order to be able to provide the comprehensive sexuality education, right? So there's a lot, and you also need to support adolescent parents and their rights to schooling, even when they become parents, to address what you just described, right, Carmen? So anyway, there are a lot of important ways that feminists can work across, I think, these different silos. Advocates and community groups can work to address some of these important ways we need to bring together these issues to really realize what was, as Marcia said, one of the core parts of the program of action, which is empowerment and shifting of the ways that people are able to really implement their sexual and reproductive health and rights. So I'm going to say thank you to you, Carmen, very much for the conversation. And thank you to you, Marcia, for hosting this Global Health Week and for putting together this program of activities where we get to reflect on 30 years since Cairo. So just really appreciate you. And thank you to Jessica and to Kim for all of your support in making this happen. It's been a pleasure working with all of you.
Bye. Thank you all.
Thank you.